Dr. Hagen, a caller called in and would like to know, how do they actually know if their child really has an ear infection or not?
Well, pediatric otitis media can show up acutely as a sudden fever, waking up in the middle of the night in pain and crying and screaming, pulling at the ears, pointing at the ears, not eating well, having a decreased appetite, and generally acting sick in nature. Other signs that fluid may have been there for a longer period of time could be the child doesn't seem to be responding well when you call the child's name, doesn't seem to be hearing well, or even when the child or the toddler is attempting to walk, to feeling off balance and maybe falling some.
So up until the time when a child can actually express to the parent verbally that they have a problem, it's all about the warning signs.
Oh, absolutely. Until about 2.5 or 3 years old, the child really can't verbalize, I have an ear pain. And the parents are generally very sensitive, especially if the child's waking them up in the middle of the night. And it's classic that they'll cry and scream, and that actually relieves the pressure in the ears and they fall back to sleep, but then the pressure builds back up and it's a repeating cycle. Or they're pulling and pointing at the ears, or they suddenly get a high fever.
So once again, for parents watching, watch their mannerisms, watch their signs.
Exactly. Watch for a change in behavior especially.